me get this other light on so that it's not so dark. It is really dark. Okay, that is so much better. All right. Okay. Hi, Clara. All right. I'm so glad. You know, it's funny. Hi, Caitlin. I haven't worn my contacts, right? And it's been about a year because of the pandemic. And they were all saying, don't wear your contacts, don't wear your contacts. So I didn't wear my contacts, you know? And then I just sort of got into the habit of having my glasses, right? And so when I started wearing them again, I think there was something wrong with the lens on the right side, because whenever I would put it in, like it would feel like it wasn't on right, and I always had like a problem with it, and then it would stop. And so it was weird. It was like I had a lash, that's what it felt like. So I finally like took it out, and I was looking at it and rinsing it off, and it still had the same issue. I would put it in the solution, same issue. So I said, maybe there's something wrong with the lens itself. And I think there was. I think it was like a half a millimeter or something off, because I tried another lens, and all of a sudden no issues, and like it's like I'm not even wearing anything. And so I'm like, it's the lens. So I'm glad I figured that out, because it was bugging me. And I was like, there's no way I'm not comfortable wearing contact lenses, because you know, sometimes if you haven't worn contact lenses in a while, it's very difficult. But I'm like, please don't let me get into that where I can't wear contacts, you know, because I like to be able to wear contacts. Even though lately I've been like still like going like this, like trying to like avoid the glasses, because in my head I think I'm still wearing glasses. No nicks in lenses. Yep, yep. I don't think it was a nick. I think it was literally the lens was made too small. Like literally like a half a millimeter too small. Because when I looked at my eye, like all I could see was like just a little bit of my brown eyes. And so I was like, okay, maybe it just doesn't fit right because it's just like a half millimeter too small. So I don't know. I think it was just defective. So at least that's my theory anyway. So, all right. So we have a couple of more minutes. And we're starting to get more people in. That is good. Did everybody hear about tomorrow is going to be study hall? So if you have any coding questions, tomorrow is the time to bring them in. Get ready. Get them ready tonight so you can be here tomorrow and we can discuss them. The idea of doing another study hall session is going to depend on how people react to this one. So tomorrow, if it goes really well, I will do it again. If it doesn't, and I don't get a lot of like audience interaction, I won't do it again, because it's all about what you guys want, and I know you guys want me to talk more about coding and stuff. That's cool. I'll do that. But at the same time, I got to get some feedback, because if I don't get any feedback, I'm going to assume you guys are not watching it. So I hope you guys watch it, because I like talking about coding, and I think it's good, especially for new students and even veteran coders, when you start talking about diagnosis coding and what it looks like, and what about this answer, and why is it this way, and if I can answer that question, I will definitely answer that question. So we are at 7:30, so we can go ahead and get started. If you are brand new to my channel, welcome. I am Blue. I'm a medical coder, and currently I am 18 away from 12,000 organically grown subscribers, because I do not have to pay for subscribers. I'm just saying. So if you haven't already, please subscribe. Please share this video at the end if it helps you. That would be great. So let us begin. All right. No, I don't have a video on HCC yet. I could, but I haven't done one yet. All right, so tonight we are talking about job listings explained. Sometimes when you're a brand new medical coder and you are looking at these job listings, they can be a little confusing, and what they're wanting, and how do you set up your resume the way that it's going to get a lot of attention from these employers, because you have no experience. And as all new medical coders know, it is difficult when you first start to get a job the first time. So the best way to set you guys up for success is if you actually understand what these job listings are saying. And this is not stuff that they teach you in school, right? They don't teach you how to look at these job postings. They just say, here's a program, go, you know. So what I'm going to do today is talk about the language of these job listings. Get your resumes in order, guys. Resumes are crucial, and they're very critical when you're out there looking for a job, because that is the only way you're going to get these employers' attention. Now, it is possible to get their attention even when you have no experience. It is about your resume and how it looks. It's got to look good. It's got to look very polished, because this is what they're going to see before they see you. So you want this to look good, so they have something to, you know, okay, let's go meet this person. So what I'm going to do is I'm going to read a few random job listings from Indeed. This is the website that I use just to find these job listings, because these can be anywhere. I'm not going to say the location of these either. I'm not even going to tell you what company these are with. I just want you guys to know what these listings are all about. So here we go. The first one is, and I just put in medical coder, okay? So there are going to be some billing ones in here as well. It says certified medical coder remote work opportunity. And then it says qualifications: high school diploma or equivalent, preferred. ICD-10, 4 years, preferred. Medical billing, 4 years, preferred. Now, before I go on with this, I want to say this first. The language of these job listings is what you got to pay attention to. Preferred does not mean required. There is a huge difference between the word preferred and the word required. With preferred, it means if you have it, that's great. If not, we're going to look at the other things that you have to offer in order for us to look at you. It's not a deal breaker if you don't have these things that we're preferring, okay? If they're saying required, they're going to be a little bit more stringent on what they want. They're going to be very clear. This does not mean that you do not have to not apply. You still need to apply anyway, even if they're asking for experience like that. Because of the simple fact that when you do get out there in the real world and these employers are trying to find people, they can't always find certified medical coders, because if you're a certified medical coder with experience, you're going to have a job, right? If you know how to do your job and do your job well, you're going to stay employed. So sometimes there's going to be that vacuum of, you know, hey, we need to fill this. So we're going to go ahead and try new people, but you have to put yourself out there. So that's why I say, even though it says preferred, that does not mean required. Apply anyway. So it says a position summary, responsible for ensuring all charges are posted accurately and timely, reviews and determines accuracy of and applies correct coding conventions, and patient charge encounters, procedural and surgical services as determined by the physician documentation, regulatory agencies, and various third-party payers. Provides departmental subspecialty specific education related to physician coding compliance, non-physician practitioner coding compliance, and appropriate coding conventions for individual physicians, residents, and collective groups within the department. This is saying that you as a medical coder, that they want you to be able to code, but not only that, you have to be able and willing to train providers. If you are coming in from a position that is not in medical and not in coding at all, but you were a teacher or you did some kind of instruction at your previous place, you need to make sure that that is on your resume, that you are comfortable speaking in front of a crowd, you have public speaking skills. These are things that are overlooked by a lot of people. If you have this talent, if you have this ability, trust me, they're going to want you, because now you have this ability to be able to do this, coupled with the fact that you know how to do medical coding. Now you have to be able to explain this to providers who can be very egocentric, and you have to be able to handle that. Can you handle people who have egos? Another talent you could put on your resume. Pay attention, folks. You've got talent. Let's get it on there. Primary responsibilities, timely input of demographic charges and time of service payment information, performing routine correct coding applications utilizing ICD-10-CM, CPT-4, which that's a CPT book, right? It just means 4th edition, that's all it is. And HCPCS codes required for the patient, 4th edition is what I mean. Required for patient charge encounters when reviewing physician generated codes. The providers are the ones that are selecting the codes, but it doesn't mean those codes are correct. That means you have to be able to go in and correct them if they need to be corrected. Ensuring compliance and regulatory agencies, correct coding initiatives, and regulatory guidelines for clinical documentation. Assist in the delivery of appropriate specialty-specific coding education for providers within their respective departments, including but not limited to teaching physician guidelines for documentation as requested. Expert ability to add specific data such as modifiers, payer-specific information, including authorization criteria, CPT and ICD-10 codes. Identifies and reports correct code selection from physician documentation, including but not limited to chart notes, abstracting, which means getting the codes from medical records documentation, medical diagnostic and interventional reports, and ensuring compliant coding selections are reported within the assigned department. Identifies provider-specific educational needs relative to professional coding and documentation. So this position is heavy on somebody that can be willing to speak with providers. Okay, you got to be able to bring your A game. Meets with providers and residents to provide focused educational reviews to enhance compliance as directed by the supervisor, and then attends and participates in all coding related educational activities as directed by the Department of Billing and Compliance Coordination, and disseminates applicable information to departmental physicians and residents and staff within the department. Act as a resource in the coding setting, in the clinic setting, for providers, practitioners, for queries related to coding conventions and compliance queries. So if you're somebody that can take a lot of questions, again, you got to outline that on your resume. Research and verify accuracy of billing data and revise any errors, including adjustments and denials. Knowledge of how to append modifiers based on payer-specific insurance and authorization requests. Understanding how to interpret correct coding initiative as it applies to charge entry. Reviews and reports all denials related to coding by report assigning and indicating reason codes for coding denials. Some of that stuff they can train you on, okay, just so you guys know. Reduce denials by the use of correct modifiers, mapping, and linking codes with services. Sometimes you will have a provider who performs a procedure, and they also perform an evaluation and management service on a separate issue. And sometimes if these codes are not linked appropriately, like if this procedure was for osteoarthritis of the knee, they did a joint injection, right? And then they saw them for an issue with their shoulder that is something completely separate. You want to make sure that you're linking that diagnosis for that injection with the appropriate procedure code, because if you're not, the insurance company is not going to assume that that injection was for the knee. They're going to make sure that those are linked appropriately. Otherwise, they can just deny and not pay. And that's their game. So you want to make sure that you're paying attention to those details, okay? So detail-oriented is this one. Responsible for processing and discrepancy reconciliation and close of charge batches across the systems. Ability to successfully track and follow up on information requests, and then work in a group to facilitate information and resolve charge questions. Qualifications. Education, high school diploma, or a GED is required. So they want you to have that, okay? Experience. 1 year of experience preferred. Preferred, not required. Certificates and licenses. AAPC or AHIMA certified. Okay, so skills and abilities. Another one to watch for. Language. Ability to verbally communicate and understand details and instructions. People don't tend to look at the fact that if they speak English fluently and they can write English fluently, that they need to have that on their resume. If you speak Spanish, that is a bonus. Make sure that if you are bilingual, you need to put both of them on there, that you can speak English and Spanish, written and verbal. So that way they know it's not just speaking Spanish, you can write it too if you can, okay? So make sure that you have that on there. Don't dismiss that as a skill, okay? Because you never know who your physician is taking care of. Mathematical, can perform basic mathematical calculations. It's not complicated, folks. Technical knowledge. Listen to this again. Extensive knowledge on the use of email. So if you have Outlook experience, write that down. Ability to effectively use payer websites. Knowledge and use of Microsoft products. Outlook, Word, Excel, PowerPoint. If you don't know how to do PowerPoint, that's okay. I didn't know either until a few years ago. But make sure that you have that. If they're asking specifically for that and you have that skill, put that on your skills list on your resume, okay? Mental/reasoning. Ability to complete work with the speed and accuracy of 93% or greater. And folks, 93% is actually low in the industry standards, because currently my accuracy standard is 97%. That's among the highest in the area. That's actually among the highest in the state. So when you have a company that requests 97%, that's pretty high. They're saying 93%. So that's a little bit on the lower side. So you have a little bit of slack. So you should be able to get this. It's being a brand new graduate, 93% should be nothing. It should be a cakewalk because you've freshly learned how to do the book, right? And then it says physical demands must be able to sit for extended periods of time. Employee may occasionally have to bend, stretch, or stoop, and then manual dexterity sufficient to use the keyboard is required. So it's a full-time job, 401k, 8-hour shift, Monday through Friday, and then that's it. So that is one of the job postings, and I saw a lot of comments come in. So let me check what y'all are saying. Woo, that's a lot. All right, so hi Auntie. Hello from Los Angeles. Always believe what I like about you is you are straightforward and honest. You give us information we need. Thank you. Oh, you're welcome. Hi everybody. Hi Christopher. Clap, clap. Let's do this. Blue, how are you doing? Missed ya. Yeah, you haven't been around for a couple days. Where I'm at, accuracy percentage isn't even measured. Wow. You're lucky, just productivity numbers. And that's the same across all specialties, which drives me insane. Like, I don't understand that. It doesn't make sense to me. Like it doesn't compute, because how can you not measure accuracy? You have to be able to measure accuracy. If not, like what you're sending in could be wrong. You know what I'm saying? It's just like not that you are wrong, but what about your coworkers? Like really, like come on, man. Like you have to have some kind of measure of accuracy, because you can't just coders can't just be like blindly say, oh yeah, you're a coder, you know what you're doing. No, actually, we have to continually learn. So that's why we all need to make sure that we're being checked up on. Hi, Guy. Yeah, accuracy takes a back seat. And if you're lucky to have PEDS provider versus family, you're automatically going to output more claims than a family practice provider. Oh, wow. Whew, now I see why that drives you nuts. It drives me nuts too. Just listening to it. All right, let's go on to another one. So this is for a medical coding hospital-based outpatient department. Okay. Qualifications, high school or GED preferred. Okay. Position outpatient, code a hospital outpatient department in the specific area of wound care with appropriate ICD-10 CM diagnosis and CPT codes while maintaining compliance and official coding guidelines. Position responsibilities: demonstrate proficiency in wound care claims coding using ICD-10 and CPT codes while maintaining at least 95% accuracy. Again, it's decent. It's lower, but it's still decent. Okay, and it's manageable. Analyze and evaluate, review patient medical record documentation and ensure accuracy of code assignment. Follow and adhere to all applicable regulations and guidelines and procedures. Maintain productivity standards on national standards and or specific client standards. Prepare daily coding logs. Work as a team player in a dynamic environment. If you are coming from working in fast food and you had to work as a team player, if you were a team leader, you can put that on your resume. Those words get picked up when they are sending it through like the electronic reader to see how much of it matches, how much of your resume is matching this job posting. And if you're saying, hey, I worked at Wendy's and I was a team lead, boom, okay, this person's qualified. Okay, we got a little qualification here. Put it on your resume, folks. Don't underestimate your previous experience. Just saying. Basic knowledge. Again, basic knowledge and experience in Microsoft Office applications, Excel, Word, Office, Teams, etc. And other duties as assigned based on the company needs and client projects. Certification, AAPC or AHIMA. Certified, demonstrate proficiency with UBO claims entry submission, minimum of 3 years of medium to large hospital-based outpatient coding experience in wound care and ED cases, minimum of 3 years wound care procedural coding. Job types, full-time, part-time, and then it gives benefits, scheduled Monday through Friday, education, high school or equivalent, preferred, and then AHIMA or AAPC required, certified, okay? And then work remotely, this one is yes. Okay, so that was that one. But the reason that I'm sharing these ones is because I want you guys to see that even if you have this additional experience from other places, that you can transfer those things over. Working as being a coder, you're going to be part of a team, whether you are working with your coworkers or whether you are working with your providers. You are going to be part of a team. Okay. This one is for a medical biller. Okay. Qualifications, ICD-10, CM, 1 year preferred. Again, not required. Medical billing, 1 year preferred. Not required. Whereas we are a small medical billing business looking to hire 1 full-time or 2 part-time go-getters. Experience with MediSoft is preferred. I guess you can look that up. Maybe they'll give you training. We are looking for someone who is detail-oriented, can multitask, has a positive attitude, and is a team player. Also someone who has an exceptional background in data entry. Data entry. If you were a secretary, boom, data entry. Can self-manage, okay, self-starter, all right, and knows the importance of hard work, loyalty, and commitment. The ideal candidate should be knowledgeable in all of the following areas: data entry, auditing, charge entry, rejections, patient statements, payment posting. So if you had to do any kind of billing for anything else, make sure you have that on your resume. Aging reimbursement, communicating with insurance provider reps or any other kind of rep, okay? Any other kind of rep. If you did communication for something else, if you worked for T-Mobile and you did communication with the T-Mobile people, you know, I'm just saying, this is just an example. And navigating their websites, software knowledge, MediSoft, Practice Fusion, availability, UNHC, Navidasphere, coding knowledge, hospital, nursing home, assisted living, office, home health, internal medicine, wound care. We are interested in someone who believes not what a business can do for them, but what they can do for their business. Oh my goodness. And if we take ownership, then we will all prosper and reap the benefits. Our office is laid back. I'm not sure if I believe that one. Encourages employees to take off their shoes and get comfortable, oh my goodness, before putting in a productive workday. We are firm believers if you spend 1/3 of your life working, you should be content in your workplace. We are looking for people who can think outside of the box and will have a will to make things better. You can work from home, PTO, holidays, quarterly bonuses, offsite activities. Schedules Monday to Friday. Experience ICD-10, 1 year preferred, not required. Medical billing, rejection, and denials in AR. Okay. I don't know if they're so laid back. All right, and let's see. Let's go back to the comments because I saw a lot come in. Let's see. What do we have? Oh my goodness. All right. John Daniel says, yeah, accuracy takes a back seat, and if you're lucky, you have peds versus family. On top of CPT2 codes, we have to submit for HEDIS measures, which from my understanding isn't something that is the normal in most clinics. No, somebody else usually takes care of it. Like they have people specifically dealing with HEDIS submissions and measures, and where I'm at, it's all on the coder. One thing I'm afraid of is where I'm working at is all right. There's no micromanaging. Well, thank goodness for that. They just care about getting your claims out, and that's pretty much it, which is good. But I try my best to keep the accuracy my priority compared to others that code out claims. Check out this, for example. I saw a claim today that was for hypertension, follow up on a past claim when I checked some things on when I'm processing the claim, and the coder did 99213 with a diagnosis of I10 Z000 and Z68.38. It's all the diagnosis connected to the E&M. It drove me nuts. The annual visit code shouldn't even be there, and the BMI shouldn't even be there unless it's documented the diagnosis of obesity. Or like, are you freaking kidding me? Like, no. Like, why would you need no? Can I wear Crocs? You can wear whatever you want to, guy. Caitlin, I've been checking Indeed every day and applying to any coding position around me lately, and I've seen coder levels 2 and 3. Yeah, those mean different things for different places. Sometimes coder 2 can be like same-day surgeries. Sometimes coder 3 is like for inpatient. I've seen other ones, coder 3 means ER. I mean, it really depends on wherever you're applying. So that's weird, John Daniel. All right, so let's see what we got here. Medical coding career opportunities. All right, so we have full-time remote positions. There's a sign-on bonus. Providing the best healthcare depends on having the best support team. Blah, blah, blah. Available for inpatient and outpatient coders. They have a senior coder, senior outpatient coder, senior inpatient coder, and an inpatient coder. These positions require 1 to 3 years of relevant experience, as well as a certification, RHIT, RHIA, CCS, by the American Health Information Management Association. Just because they said only AHIMA doesn't mean if you have AAPC that you can't still apply anyway. Okay. And that was it. Okay, that was a short one. That wasn't the one that I wanted to see. Okay, this is the one I wanted to see. So this one is for a certified medical coder, medical coding, 2 years. Now this one is saying required. English required. AHIMA or AAPC license required. Microsoft Excel, 1 year preferred. So they clearly know the difference in the language, but it doesn't mean that you shouldn't still apply anyway. Full-time job position is a rapidly growing coding and auditing company seeking qualified candidates with at least 2 years of experience and a strong background in multi-specialty ASC, ambulatory surgery center, environment, including orthopedics, plastic surgery, lesion coding, nervous system, ENT, GI, etc. Applicants must be proficient in DRG, ICD-10, PCS, and CPT codes. Candidate must be currently certified with either AHIMA or AAPC and have the dedication to work from home and meet deadlines. Excel and Word proficiency is a plus. Applicants must be able to commit to a set amount of time each day and be comfortable with multiple state regulations, including Medicare LCDs and facility-specific guidelines. Note, you will be brought on as an independent contractor for approximately 90 days, after which time you will be reviewed and you will receive constructive feedback. At that time, a full or part-time position may be offered depending on what you are seeking. Full or part-time, then it gives the pay, then it says about like are there benefits, experience, medical coding, 2 years required, Microsoft Excel, 1 year preferred, ASC, 1 year preferred, ASC coding. Language is English, is required. AHIMA or AAPC, and that's it. Yep. That's it on that one. And then we have certified medical coder and billing specialist, ambulatory surgery center. High school diploma or a GED is preferred. Ambulatory surgery center, coding, billing, and collections, 5 years preferred. Medical coding certification is preferred. The job duties: create invoices for services provided to clients within their electronic medical record system or practice management system. Ensure appropriate charges are applied to invoices within the EMR PM system for services provided to clients. Ensure appropriate CPT, HCPCS, and ICD-10 CM codes are billed by clients. Post payments from third-party payers. If you have cash handling experience, this is also good to make sure you have on your resume. Okay, and patients that are collected and scanned into the EMR system. Download ERN files. I don't know what that is. To client server from client's clearinghouse. Review auto-posted activity and ensure accuracy, correct information incorrectly posted. Determine if claims need to be refiled or submitted for appeal for clients. review and respond appropriately to appeal requests for third-party payers within a time frame required by the payer. Verify patient insurance and benefits eligibility. Assist client determine time of service, financial responsibility. Document work performed and action taken within a client EMR PM system. Answer phone calls covering balances and adjudicated insurance claims posted to clients' EMR. Communicate with designated client representative, usually the office manager, concerning topics related to billing and collections as directed by the team manager. Job requirements: certification as a medical coder and or medical billing and coding, high school diploma or GED, strong verbal and written communication skills. Again, guys, you have to have that on there if you're good at it. Previous 3 to 5 years experience in medical coding, billing, and collections in ASCs is required. Still apply anyway. Experience in EMRs, EHRs, and clearinghouses. Ability to work effectively with a team to achieve goals and complete tasks. Knowledge of common medical billing and coding practices. Strong understanding of medical terminology and ability to use in daily tasks. So then they give it's Monday through Friday, bonus pay, and then that's it. So everything I've been telling you guys: anatomy, medical terminology, pathophysiology. These are all important things to have on your resume, folks. So important. All right, let me check the comments. All right, what do we have here? Yeah, I don't know. Sometimes I feel like I'm learning bad habits. Like here, I have a lot of freedom and correcting the claim. Hey, Blue, if your provider chooses E11.9 diabetes and has a separate G62.9 for neuropathy, do you autocorrect and code out for E1142 as long as the documentation supports? Why wouldn't you? I mean, if the documentation is supporting it and you have to combine the code, then yeah, you combine the code. You wouldn't put them separately. That would be like coding chronic kidney disease and hypertension separately. You know, that's a combination code. You combine the codes. And even when you look in the guidelines, it's there too. So if it supports that it's together, then naturally you're going to put those together. The benefits where I'm at are great, but I feel like I've got to find a part-time coder gig on the weekend because I feel like I got to learn how most other clinics code. It wouldn't hurt. Because where I'm at is just worlds different, and it makes me fearful if I'm set up for failure if I choose to move on. That is a good way to think, because at least you're staying on top of it and you recognize there's something not right. Something doesn't feel right to you. So go with your instinct on this one. Unique says, hi, Blue. Thank you for this live. Question: I am applying on LinkedIn for the risk adjustment position, but it seems like you have to be certified. Do you have to be certified? No. Unless they're requiring you to be certified as a medical coder, then yes. But I don't. Am I missing something? Can you give me a little bit more detail, Unique? Because I don't know. I don't know. I guess I'm not quite understanding what you're trying to ask. John Daniel says, just making sure. I heard some places are strict on code changes. Why? Okay. That's our job, right? Is to select the correct codes. If the provider is selecting the wrong codes, or if the wrong codes are in there, then if this is what we're touching, this is our responsibility, this record. We open this record and we look at it. You cannot send inappropriate codes through. And it's just like the fundamental basics of medical coding is that if there's an incorrect code, you put the correct code on there. If you can justify your selection of a code that has to be correct, then you're fine, because there is no well, it's selected, so you submit it the way it is. If it's incorrect, it's actually against ethics if you submit something that's incorrect, because it could cost the provider money, it could cost the patient money. Most of all, the patient. You got to think about the patient. And you have to think that these diagnosis codes, these procedure codes, they follow this patient everywhere. So you never know who is going to have their hands on this patient's record. So if the code is incorrect and it's your responsibility to make sure that these codes are correct, then you need to correct the codes. I mean, if it's like, to me, if somebody's going to be that micromanaged on like, well, you can't change nothing, why are you even there? Because like, I wouldn't. I would not take a chance on that. I am not losing my credential for you. Definitely not, because we are bound by our ethical standards. The AHIMA standards of ethical coding says that if you act in the capacity as a medical coder, you will follow these rules. And one of those is that you have to look and get the correct code. And of course, I'm paraphrasing that. But when you're coding, that's what you do. I mean, if it's wrong, you cannot submit it as it's okay to do. You can't do that. You have to put the correct code before you submit it, because otherwise you end up with a denial. And I don't think that like offices and doctors want to wait on their money. This is what I'm saying, let's see. And I wasn't sure. So if it's like that, then I'm good to go. Clara says, can you start out as a remote medical coder? On chapter 4 of my COC program, I get discouraged from time to time, and I truly want to be a coder. I'm going to pin this just a second, okay? Philip says, hi, Blue. I passed the CPC exam, and I'm trying to find a job here in the Philippines. Just want to know what is the difference between DRG and SIU coding. I don't have no idea what SIU means. What does SIU mean? John Daniel says, well, it's an FQHC, federally qualified healthcare, right? And apparently it's a different type of clinic and are paid differently. Have you ever used Athena? Me? I use Athena? No, I've never used Athena. But back to your question, Clara. Oh, how do I say this? So we're still in the pandemic, a little bit. Some places are coming back to the facilities. Some are still leaving their coders at home. It really depends on where you are. So for some places, they're still accepting brand new medical coders to start remotely, okay? Others are not. They are expecting you to be at the facility, and they want you to get trained there, and then sometimes they will send you home. Other times they are wanting you at the facility because that's where they need you. A lot of times people want to do remote because, oh, it's medical coding. You can do it at home. You can do it remotely. It's good and it's bad to do remote medical coding. Okay, and I'm going to play both sides of the fence right now, okay? It's good because if you are the type of person that lives way out, or you have some other transportation issue or whatever, it's nice to be at home, to be able to work at home. The bad side is if you are not there with the providers and they have no access to a coder, they are going to run wild. And I've told my boys before, it's like herding cats with all of you. You get out of the basket and you just run. And I said, then I got to herd all of you back into the basket. And they all laugh at me, but it's true. I got to herd you all back into the basket and get you all to do things right again. If there's not a coder that is on staff where they can see them and have that interaction with them, that's what happens to the documentation. It goes whatever way the provider wants to be. When you are away from your providers, it makes it harder for them to understand this voice that's on email, communicating with them. It's easier for them to ignore you. Because they don't know you. They don't know who you are. You're just somebody who's filling up their inbox with queries. So while it can be good, it can also be bad, So there's two sides of the fence on this one. And I think with some facilities, they get this. That's why they want their coders to be in the clinic or on hand, so that way if the provider needs them, they're going to be available, because when they're away from them, the provider's just going to do whatever they want to. And again, if stuff is not being documented appropriately, it's harder to catch them, because then you're just, when do you meet each other, right? For me, that I'm there in the clinic, if I need to grab them, if I see that I'm going through the documentation and I see them start to lag on the details and everything, I can grab them the very next day and be like, okay, what's going on here? Because oh, I forgot. Okay, well, let's get back on track so that way we could get this, going right again. Because if you stay away from them, and you don't happen to catch it in time, that's part of the problem. So again, while it's good when the provider has been well trained, and then you stay at home, and then you go to the facility a couple days out of the week. That's okay too, because at least they have some kind of access to you. John Daniel, I hate coding, but I love it. I hate remote coding, but I love it. It's stupid slow when you have to work through software to log into a virtual desktop via Citrix. I hate Citrix. Oh, and it's slow, lagging, and slow. I had that problem when I worked at home. I could not stand it. And then I would get a call from my boss. Blue, what are you doing? What do you mean, what am I doing? I'm working. Well, I see from your production, like, why are you looking at my production? It's not even the end of the day yet. Well, I mean, I see that you've only done 24. That's because my internet is really slow. Then you should have put in a work order to, oh, come on. It's not that way all the time. Like, what am I supposed to do? It's my production, and it's only been a day. Like, relax, But that was the issue that I had. So I'm like, bump this. I'm going back. So I had to go back, because I'm like, no, I can't. Because I can't, that micromanage, I can't do that. That I cannot do. You want to stress me out fast? Micromanage me and watch what happens. I can't. Like, it stresses me out so bad to be micromanaged. I would rather have a hectic office and deal with a lot of busyness than to be micromanaged. Can't do micromanaging, guys. I cannot. I ended up going to a different route and got in trouble, but complained to HR to keep it, because it was a lot faster than just directly using the work provided VPN than access to Athena. Most of the people still use Citrix, but apparently upper management who were provided their own laptops basically logged into work from home the way I'm doing it now. See, so there's people who get like the easier ones, like the easier ways to get in, because we had that issue too, where we had a couple different options to choose from, and you had to like just hop on the one that they had told us to. But if you keep getting kicked out, then you can hop onto another port, and so that was how that little game was played. But it was just the lag time alone, and then when you have to think about, like, you're in a neighborhood, you're in an area that's got like a lot of kids, and they're all you know what I mean, so like the internet just goes crazy and everything's just like bogged down, and you have peak hours. And a lot of people were asking too if they could just work off peak hours, like instead of working during the day when everybody was working, then let us work at night, because working during the day is not going to work. And it's just like, again, the micromanage deal, so essentially removing Citrix and using the same method that providers use to connect. And that's what I do. Well, you're very good at it then. That you actually get it. So that was good for you, But the moral of the story today, guys, when you're looking at these job postings and you have some of these skills, because you got some of these skills, guys, it does make a huge difference, especially when you apply it the correct way. Everybody's got a good writer in them. I say this all the time. Everybody does, no matter if you hate to write, because we all have thought processes and we all have a way of expressing ourselves. We just have to tap into the best way for us to communicate. I like this one. This one is a medical collector, and it says relevant 1-year experience preferred, not required, Medical collections, 1 year preferred, not required. Language, English or Spanish, bilingual, preferred. Excuse me, this position requires a successful candidate to be able to work Monday, Wednesday, Thursday, Friday from 8:30 a.m. to 5:30 p.m. and Tuesday from 11 a.m. to 8 p.m. This is a remote position. However, please note that the training will be conducted at our corporate offices. And it says the core values, blah, blah, blah. Vision statement. We are an equal opportunity employer. Why did I want to read this one? This job is ideal for someone who is dependable, more reliable than spontaneous, people-oriented, enjoys interacting with people and working on group projects, adaptable, flexible, enjoys doing work that requires frequent shifts in direction, detail-oriented, would rather focus on the details of work than the bigger picture, achievement-oriented, enjoys taking on challenges even though they might fail, autonomous, independent, likes to work with little direction, high stress tolerance, keywords there, high stress tolerance, thrives in high pressure environment. If you can do that, you need to put that on your resume. If you can tolerate high stress levels, not that you would welcome it, but you can do that as a talent. Okay. This job is open to applicants who have a high school diploma or a GED. A good job for someone who is entering the workforce or returning to the workforce with limited experience and education. A job for all ages, including older job seekers, are encouraged to apply. Open to applicants who do not have a college diploma. Work remotely, yes. So this is a very laid back place. That is really awesome. So what did I see go there? I was lucky though to be able to get in the way that I wanted when the head of HR sided with me. LOL. I physically showed him the difference, and given my GWAM and ability to keep quality while staying in the top 3, the amount of claims processed in a day. Oh, okay. Well, that's good. At least you were able to work that out. That's good. Gross words in a minute. Oh, mine is 180. Oh, that's good. At least I think that's good. All right. Okay. So, I think is that all I wanted to go over in this one? This one's about, no, this is the nurse one. I don't want that one. There goes that one again. The home health. I guess there's another certification out there for home health. That's new to me, but I guess it's one I've heard of it before. People have been asking about it. The COS-C, that OASIS certification, OASIS. I guess there's a certification for home health if you're gonna get certified in home health. People have been asking. This is the first one I've seen asking for that one. But I guess if you're interested in that kind of deal, then you would go with that. COS-C or HCS-O OASIS certification prior to hire. 3 years of experience with OASIS in coding in a home healthcare setting. Is it that serious that you would be so different? But I guess maybe it's just, I don't know, maybe it's the billing side. I'm not sure. If you know about that one, comment, because I sure as heck don't know. always says my current job is a 911 call taker qualifies me for the high stress part. I'm sure it does. You know, I've always wondered what it's like a day in the life of a 911 call taker. You know, I can imagine that would be like so scary, but then at the same time, like if you have those moments where you're saving somebody, you know, like just like that, you know, I don't know, because you have to be that calm person when there's so much chaos and there's so much scariness, and it's just a few moments of scary, but it can be like an eternity, and like your emotions are like all over the place, but you have to be that one calm voice on the phone to help that person out of a jam. And it could be anything that you experience, from a cat being stuck in a tree to somebody's home being broken into, or you know, whatever, disaster. Oh my goodness. Yeah, that definitely qualifies you. Right now I can say, John Daniel says, my goal is to be as accurate as I can and stay in the top 3 of productivity. Simone says, I need interview tips. Okay, pin that one for a second. Caitlin, it's crazy that I'm trying so hard to get in an office coding position, and then seeing all these remote positions. I just want to be in an office. I totally get it. I totally get it. It doesn't matter to me. I just want a coding job. John Daniel, we had a coder meeting about incentivizing coding quality over quantity, though not directly said, but that's what was said. So now everyone is making less changes, and I'm afraid they'll submit claims as is. Apologize for all the typos. I'm kind of venting. It's okay. You explained the 911 position perfectly. And you know what else you have too is details. And because when you can't get details from a caller, like you can listen, like, what did you hear? You know, did you hear water? Did you hear screaming? Did you hear gunshots? You know, that kind of thing. So you're very detail oriented as well, because you have to be able to put in all this detail so that like the officers that are coming can know what to expect. Or if you have to call for an ambulance, you know that either the patient isn't breathing, or you know, you have like so much detail that you could put on your resume. That would be so interesting to see what your resume will look like, for sure. Guy says, that want for an office position sure is a turnaround request, isn't it though? Isn't it? Because everybody's been so for remote coding, and to have somebody that wants to go into an office is a nice refreshing change. But let's see. So interview tips for Simone. Okay, so since we're okay on the job postings, explained them pretty good, I think. Now the interview tips. So when you are interviewing, right? And naturally, you're going to be nervous. It is okay to be nervous. What is not okay is to let those nerves take over. Okay. Your goal is to get the job. Okay. So all of this nervousness, you could put that aside. Okay. If you're doing a virtual interview, just be thankful you don't have to shake hands. Because okay, you know, you may get nervous, you may get sweaty hands, and you don't have to have that when you're having a virtual interview. So you can think of it as, hey, I'm going to meet a friend, and they don't have to know that your hands are covered in sweat. Okay, because I get sweaty hands when I meet new people and I have to shake hands sometimes. A lot of times I'm okay, I'm cool under pressure, you know. But there are some people, like their energy will, I'll just absorb their energy, and like all of a sudden I'll just get really nervous. So it does happen to me occasionally, but you know, more often than not I'm okay. But when you are doing virtual interviews and you're meeting the people, just make sure that you take a deep breath before you speak. It's not, you can always think of it like this. If I don't get this position, it's all right. It's not the end of the world, because there's always going to be another one out there. What this position interview has done for me is prepared me for the next one, because the more interviews you go on, the more relaxed you will be, because you'll have less nerves. You know, you'll be used to it, right? And you'll be able to say, okay, I'm a pro at this. This is a new friend. That's the way I always tell people. When you're going for an interview, you go like you're talking to a friend. Because when I got my position here, I remember it very distinctly. I told them up front I was nervous, okay, because I was far away. I was doing a phone interview with them because I thought I had to be there, and they go, "No, we'll do a phone interview. We know that you're far away from us, but we'll go ahead and do a phone interview with you." So I was like, "Okay, cool." So the day of the phone interview, I'm there, and I'm in my apartment, and I'm so nervous. I'm like, I really gotta get this job because I really want to get closer to home. This is gonna be my ticket out of here. And so I told them, they were like, "Oh, good morning, hello. We're excited to meet you. We've got 3 people on the line." So they had a panel. Okay, be prepared for that. Okay, when you are going for an interview, be prepared that you may meet in front of a panel. And it's going to usually be like a coding supervisor, a lead, maybe somebody from data quality, maybe a provider. And sometimes the providers are included on this as well, So it really all depends on how hands-on these people want to be with you. But typically it is just like the coding supervisor, data quality people, the lead, and that kind of thing. So I had these 3 people on the phone, and it wasn't video. Okay, you have to remember this was back in 2009. So it was over the phone. So as I'm listening to them, they go, "Okay, we're going to give you a series of questions, and then you just answer them the best you can, and then use your book if you need to." So I was like, "Okay, cool." So as I'm sitting there and I'm talking to them, and I forgot something. I can't remember what it was, but it was one of the sections I could not remember, like off the top of my head what it was. And I said, "You know what? I'm so sorry." I said, I'm gonna stop for a second. I said, "I am so nervous." And they go, "Well, don't be nervous." They go, "You're among friends." And so that immediately put me at ease. And this woman that I was interviewing with, she was a former drill sergeant. So you have to keep in mind that I'm hearing her voice. I know she's a strong woman. And at the same time, she just put me at ease, just like that. And I was just like, okay, I'm like, I can do this. Okay, I can regroup. And I kept having to tell myself, I am skilled. I know what I'm doing. I just have to be able to say it and answer their questions as honestly as I can and answer everything. Don't say, "I don't know." You never say, "I don't know" in an interview. Whatever you do, please do not say, "I don't know," or no. You need to be direct. Yes, no. Well, I did. And then you have to be able to give an answer for everything. And if you need a couple of minutes, then just say, "Well, you have to think of something to say," to fill that time, to give yourself time to think of what to say. All right. But try not to overthink your answers. When you overthink your answers, that's when they know you're trying too hard. Okay. They're nervous too because they need to find somebody to fill this position. And whatever they've seen on your resume, whatever they've seen on your cover letter, they like. So already have that in your mind. They already like you because they're calling you. They need you. Now it's up to you not to blow the deal, right? By being too nervous and being too hard on yourself. You have to give yourself a break and the benefit of the doubt and be like, "I'm just going to put my best foot forward, and that's all I can do." The best thing that you can do is have your materials with you, like your coding books and stuff. You have them on hand. If you do not have coding books, the best thing I can tell you to do is, if you're doing this a virtual thing, make sure you have a computer nearby that you can ask Google real quick for help, because if you don't have coding books, it's okay. Sometimes they'll know that you won't have coding books, but it's always a good thing to have them, so even if you have last year's, that's all right too, because there's still a lot of really good information that you can use, okay, especially if you need to kind of go over whatever, but just having those types of things in mind is going to help you. When it comes to interviews, every interview is going to be different. Some have it just one-on-one, and some have it with a panel. So just be prepared. And again, don't freak out because you've been trained. At the end of the day, you're not some Joe walking in off the street not knowing anything. You've literally been through school, you passed your certification, and now you're out there trying to finish the deal by getting the job. And just rely on the fact that you've gone over these things, you have your skills, you're not walking in there blind, you know your medical terminology, anatomy, and pathophysiology. You know, why do you want this? Think about your why. You know, I had to think about my why. My why the whole time in my head that I'm having this interview with people that just told me you're among friends was I wanted to get home. I wanted to get home. I wanted to be with my mom because my mom was sick. And I wanted anything and everything to be with her. I just wanted to be there. And having that, it was just like, there was no failing. That was in my head. It was no failing. I needed to have this position because more than anything, I just wanted to be with my mom. I just wanted to be with her. And I just did what I had to do. I told them very plainly, I've been coding in professional fee services for the last few months. I have increased productivity from the standard of what I did before, of what they had before, which wasn't very much. And I figured out a way to do it because I was literally lining up these encounters and going and keeping my productivity and my accuracy up, because my accuracy was really good because I was working with these providers one-on-one, and I was saying, okay, we need clear and consistent information. You know, you can't say it's one thing one day and then like it's completely gone the next day and you're still treating it. You know, I still need to see it on there because you're showing that you're still treating it. It needs to be there. And so they didn't understand, and so they were able to get that going, and then I was able to keep those production standards up. And I was working crazy hours, crazy long hours, because they wanted to get that revenue back. There was so much revenue that was being lost because a lot of these encounters were not being coded out. So we had to do overtime, and I was doing overtime like crazy because that's all I wanted to do was just get the bag and go, you know. And so that's what I did. And so they knew I worked hard, and they were like, okay. And they knew I was serious, and they asked me, you know, what was my favorite clinic, and I said I really liked internal medicine, and I really liked psych. I enjoyed doing psych. I enjoyed doing ortho. And so they were very excited about this. So that's when they said, okay, well, how soon to the day when you get the call can you be here? And I said, 2 weeks to the day I get the call, I will be there. I will be there. And they go, okay, we know you're moving from out of town. Are you sure? Yes, I will be there. And then I said, okay. And I was so sure I had it. I was so sure I had it, gotten it. I was just like, that was an awesome interview. I did it. And I called my mom. I was excited. I was like, they liked me. It went really well. I just can't wait to hear. And then I didn't get it. I didn't get it. And the job closed and I didn't get it. And I was just like, well, what now? And so it was a couple of months later. And my mom, I was telling my mom, I was like, I didn't get it. And I was crying because, of course, I just wanted to go home. That's all I wanted. I just wanted to go home. And my mom was like, don't worry, it's not your time yet. And I remember my mom saying that. She's like, it's not your time yet. Just wait. Just wait. And she says, it's going to be something better for you. So I said, okay. Because you got to believe moms. Moms say no. 2 months later, in April, same job, but a higher position opened again. I'm applying anyway. And the girls that I worked with, they were like, no, you're wasting your time. You'll never get it because it's a higher position. You'll never get it. I said, well, they already denied me for the first one. What's the worst that can happen to the second one? I don't get hired. They already did that, you know? So as soon as the job closed, a few days later, I got the call. I got the job. Actually, I got the letter, you know, the email. Said I got the job. And if I would accept, let them know. I think the entire city heard me screaming. I was so excited when I got the job. And I was just like, first one on the phone was with my mom. I was like, I got it, you know. And she was like, she goes, see, I told you. And I was like, yes, you did. You did. And she flew up to help me. I got one of those cargo vans because that's how little stuff I had. I had just a little bit of stuff. And I packed up a cargo van of my stuff, you know, because again, I didn't have any furniture, didn't have anything. And it was like my bags and my clothes and my shoes, you know, and just a few pots and pans. and I came here. you know. And then it was about a week later I started, you know. So, and I've been here ever since. But that was how I got through that, and having that whole time in my head, the why, why are you doing this? That's what gave me that strength. Because trust me, I was just like so emotionally exhausted. You know, I just wanted to get where I wanted to go, and I wanted all these roadblocks to stop, you know. And it was just sheer determination. It was sheer determination. And like I said, I've been here ever since. And I had the opportunity to move about a year afterward, and I was like, no, I don't want to leave. I had already moved so much, you know, in not even a year's time, and didn't want to leave. So I've been here ever since. Let's see what we got on here. Let's see. Oh, I missed a lot of comments. Oh my goodness. Okay. John Daniel, I'd suck as a caller. You'd have to take a polygraph test to even be considered for a job like that here, dealing with law enforcement or EMS services. Caitlin says, the interview I went on, just the presence of the office atmosphere made me excited, and I just wanted to start right then and there. Aww. John Daniel, hey Blue, do you take part in interviews of coders? And if so, what are the common questions do they start asking coding related stuff? I'm gonna pin your comment for a second. I was a cake decorator for 3 years. I know about high stress. You know what? Cake is not a joke, okay? John Daniel, sigh, a friend gifted me a CRC prep course from AAPC, and I really don't want to do it, but I'll feel guilty if I don't, even though I have the CRC to my name, just decided to randomly take it without studying, and I passed it, and I was shocked. You shouldn't be shocked, John. You're a freaking smart guy. Caitlin says, good job, but you can look at it as a refresher and just free knowledge. I say too much, but I usually follow it up with something smart. I'm like Barack Obama that way. I think it's my thinking motor humming. Cisco works better than Citrix. I bet it does. Christopher, John Daniel, it's like required. Just like me, needing to chew large amounts of gum like a horse to sharpen my focus. Hi, Floor. Yeah, Chris, that's what I use. Just the VPN through, though, and that allows me to connect the sites that needed it on my own computer, and I had to bring my own computer in to show them that I had cleared everything in the factory so that I could do it. I wish they would just put us on salary. Like, put us at a decent salary. 40K a year is great as a starting point, and I bet work and claim productivity would be better and cheaper at the end. Though I think it should be a choice to some coders, because some don't like the idea of salary, LOL. I do, because I'm on fire towards the later afternoon of the day where I'm working like a turtle in terms of work. Simone says, I feel your pain, Blue. I've had lots of no and cried many days. It's refreshing when it finally does happen. Yes. Caitlin, I take my CCA next month, and I'm hoping once I get it under my belt, I'll get interviews, more interviews. Never give up, people. That's true. Never give up. Caitlin, when I got the email, I asked if I needed to bring my books. Did they tell you yes or no? Who did I say I was pinning their comment? Oh, the questions. No, I have never actually sat in on an interview. However, I had a friend that actually came here from the place that I actually came from. And she worked here for about a year. And she was just like, hey, I have an interview. Can you I don't know where to go. And I'm like, oh yeah, I could take you. So I brought her up, right, to the room. And of course, my boss is sitting there. She's in the panel, right? So it's my boss and the 3 other supervisors. So there's 4 supervisors altogether. Then there was the one from data quality, and then somebody else from the inpatient side, right? And so they're all sitting in this panel, the 6 of them. And they're all in front of her, right? And so I'm bringing her in there. And of course, she's nervous now because she sees 6 people. She's not expecting 6. She was only expecting like maybe 2 people. And so I go, hi, everybody. And my boss is just giving me this evil eye. Like, what are you doing here, Blue? And I go, hi. I go, this is my friend. And I introduced her to everybody. And then I said, this is, and I named my boss, and I named the 3 other supervisors. And I said, I'm sorry, sir, I don't know who you are. And then they go, well, this is, and so he introduced himself. He kind of like smiled at me, and I'm like, oh, okay, well, this is him. And I said, it's nice to put a face with a name. And then he's like, kind of like laughing. And my boss is looking at me like, get out of here, And I go, bye, everybody. And I go, my friend here is very skilled. I trained her. And so that was how I left them. And I said, I'll see you later. And then so she's like, okay. And so then she did the interview. And then when she came out of there, she's like, oh my God, can you come down and meet me? And I'm like, yeah. And then she's like, wow. She's like, that was your boss, and that was everyone. I said, yeah. And then so how did it go? She's like, well, it went okay. They were asking me, basic questions about the book and, my experience and what did I do before. And I told them I did Practicode, and I said, okay, good. So all the things that I had trained her on. And she's like, well, I said, well, what did you ask them? And then she goes, well, I was asking them more about like, what were the hours, and, if I could a choice of the schedule and things like that. And what was the productivity standards? What was the accuracy standards? And she goes, it's a lot higher here from where we came from. I said, yeah. She goes, even the accuracy standard is higher. I said, yep. And so she goes, is it doable? I said, yeah, it's doable. I mean, it's not, you get used to it after a while, because you start to balance like what you do and productivity. If you have a more difficult clinic, you balance some of that. You start working some of it, and then you use some of your easier stuff, and then you go right back to the hard stuff. So that way you have an equal balance at the end of the day. And then you've met productivity, you've met your accuracy. So, that's the way you do it. And so she was like, oh, okay. She got the job. So, but my boss was like, you trained her? And I said, yes, I did. And then she's like, and she didn't have experience before. I said, no. I said, she was a brand new coder when I got her, actually. So when she came on board with us, she was just green. She was so green. And she had gone through an online program, and so she still needed a lot of work. And so I got her up to speed, and she did really well. She was one of the strongest coders, at the facility. So, but that was what, we went through. But when you're asking questions, I did do a video. I need to review that video, because it talks about like some of the questions that you can ask employers, and I'll reshare it on the community tab, so that way that way you guys can watch it. But but that's, I guess, my episode for today. Tomorrow is going to be study hall, guys. Okay, so I will keep doing study hall if I get a lot of interaction, like a lot of questions, and everybody's participating in the study hall. And it's just going to be your coding questions. Whatever coding questions you have, get ready, because sometimes I get like random coding questions, and I'll answer some of them, depending on how fast I can get to my phone and how easy the question is. Some of it I have to like look at the documentation, but if you have a coding question, tomorrow would be the day to ask, because it will be well, no one else has said anything, John. It was us talking for a while, but I mean, a very good night to you, Guy. You had a good session. Good. But again, get your coding questions ready. If you have a coding question, let me know, because people are asking me, they want more coding stuff. Okay, I'm going to give it to you guys, but again, I got to get some back, interaction. So I'm going to wrap this one up. If you haven't subscribed already, please do. Share this if it helped you. Like, subscribe, share. So I'd like to know more about your work process. That's a good show topic. I think I'll have to do that for another day. Jocelyn, I'm excited. I haven't got to the coding part of my studies, but I look forward to hearing what kind of questions other people have. And that's sort of the goal too, to see what other questions, other coders have. So that way, even the new coders that are still in school can kind of get an idea, of what to expect. I won't be asking any questions, but I will definitely be listening. And that is all you need to do. And taking notes, hopefully. So, thank you, Floor. Thank you so much. All right, guys, I'm going to wrap this one up. Y'all have a good night, and I will see y'all tomorrow for study hall. Bye.